In Malaysia, anxiety is one of the most commonly reported and escalating mental health problems. Panic disorder is a type of anxiety disorder characterized by recurrent unexpected panic attacks. Common symptoms associated with a panic attack includes elevated heart rate, shortness of breath, hyperventilation, and sense of derealization. Treatment for panic disorder focuses on reducing symptoms via cognitive behavior therapy, CBT, with a qualified professional, and medication. A vital part of CBT's process involves homework assignments between sessions, which could include recording incidents that provoke anxiety and exercises to cope with panic attacks. However, patients can forget the exercises they need to do when encountering anxiety provoking situations, due to the fight or flight stress response affecting their ability to think and behave logically.
This figure shows the function analysis of operating the smartwatch for anxiety. The wrist is needed to hold the smartwatch in order to use it. The smartwatch will then produce emergency contact, daily report for user's activity, body report, suggestions to overcome anxiety, heart rate sensor, and breathing exercise. Emergency contact and daily report need to be connected to the user's phone via mobile application in order to inform the user. The body report, suggestions to overcome anxiety, heart rate sensor, and breathing exercise informs the user. This table shows the 9 windows. We applied level 3 of Archela's solution. It refers to essential improvement to an existing system using methods known from other fields. Smartwatches are used to provide various features besides timekeeping. For instance, providing reminders and receiving or making calls. We use smartwatch to add specific features, which is to manage users' panic attack. Individuals with anxiety disorder, while our product is smartwatch. The limitation that might happen to users during the utilization of smartwatch is the inconvenience of use to some users, as not everyone is tech savvy. Thus, by providing the smartwatch multi-feature, we'll be able to deliver its function, which is to reduce anxiety, and users can seek help or consultation from therapists on how to operate the smartwatch and learn its function. Moving on to the physical contradiction. The contradiction statement is, the smartwatch should be easy to be used by target users, especially those who are novice users, but the smartwatch should be customized according to the user's needs, so it is not a one-for-all device. To resolve this physical contradiction, 3 main approaches are used, which are separation, satisfaction, and bypass. Separation approach is mostly used, and there are 4 types of separation methods, which are time, relation, space, and system. For the separation in time, we use 3 principles, which are nested doll, dynamics, and mechanical vibration. We applied nested doll by providing a lot of functions and features that will help the target users to manage their panic attacks. For example, heart rate tracker and exercises that are designed for users. Also, we apply Principle 18 mechanical vibration for separation in time. When the user's heart rate increases drastically, the smartwatch will vibrate to alert the users about the change. For separation in space, we use 2 principles, which are asymmetry and another dimension, to resolve the contradiction. The solutions are, first, the smartwatch will be tailored depending on the user's needs. Hence, the smartwatch will differ from one user to the other. Second, combining the features of fitness tracker and panic attack management application to enhance the performance of the smartwatch. For separation in system, we use 2 principles, which are universality and feedback. The solutions are, first, other than keeping track of users' heart rate, the smartwatch will guide the users to lower their heart rate and be able to contact the user's close contact for emergency if the panic attacks are severe. Secondly, by providing feedback to ensure that the users are okay and record the heart rate of users. The time taken for the user's heart rate to stabilize after it increases are also recorded and provided for the users to keep. Pattern search was done to prevent the infringement of intellectual property. We use very specific key terms such as anxiety disorder and smartwatch to identify whether it has been done. It was found that there is no invention of smartwatches to manage mental health, specifically anxiety disorder yet. Therefore, we decided to proceed with our idea.
To solve this problem, we propose a smartwatch to help clinically diagnosed anxiety patients manage their anxiety, especially if they experience panic attacks. Based on the cause and effect analysis, after reducing unlikely causes, we identified the potential actual root to the problem, which is continuous anxiety attacks, as never having received therapy, no exercise guide, and unaware of incoming panic attacks. There are various smartwatches in the market that caters to different needs. To compete with others, we turn to the 39 by 39 contradiction matrix. We want to improve the reliability of stopwatches by adding features that tracks panic attack symptoms and suggest methods to manage them. However, we believe that this would cause inconvenience, especially if the various suggested methods is insufficient in managing users' panic attack. The identified improving parameter is parameter 27, reliability, whereas the worsening parameter is parameter 33, convenience of use. The contradiction matrix suggests that inventive principles 17, 24, and 40 would solve this contradiction. We decided to use principle 17, another dimension, by using a multi-story arrangement for the smartwatch's features. We combine features that tracks heart and respiration rates via PPG. To manage the symptoms, the smartwatch relies on the user's therapist's input to create methods to reduce excessive heartbeat. The watch will then record the event. Different patients experience panic attacks differently. Some recover after receiving breathing exercises, some by distractions or grounding, while others need to get affirmation from certain individuals. So it is essential for patient and therapists to identify their own unique symptoms to effectively find a solution that matches their needs and apply it to the smartwatch. If they find the methods are no longer suitable, users can consult with the therapist to change the anxiety reducing methods in the smartwatch.
To increase the smartwatch efficiency and reduce the cost of its engineering system, trimming rule C is applied, which means the function is transferred to another component in the system. Based on the functional analysis, we trim body report component and transferring it to the daily report component. We also trim the breathing exercises component and transfer it to suggestions to overcome anxiety component. This will ensure the efficiency and simplicity of the system.